Hi friends, good evening. Once again, welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam preparation. Also, these questions will helpful for your coming nursing officer exam preparation. In the previous video, we discussed first 16 questions from previous year question papers, and the continuation of same question we can see in this video. This set of questions consists of both nursing and non-nursing questions. Mostly I am focusing nursing questions first. Then after completing nursing question, together GK question we can discuss. Question number 16. Which is an example of a vector? Options. Option A squirrel. Option B mice. Option C ticks. Option D tapeworms. Example of a vector is ticks. Answer it is there. Ticks. Option C. To the next question. Which of the following enzyme is not involved in digestion of carbohydrate? Options. Option A lipase, option B amylase, option C sucrase, option D lactase. Which enzyme is not involved in digestion of carbohydrate? And the correct answer is it is lipase, option A. Next question. Full form of CINAHL. CINAHL means options. Conceptual Index to Nursing and Allied Health Literature is the first option. Option B, Comprehensive Index to Nursing and Allied Health Literature. Option C, Catalog Index to Nursing and Allied Health Literature. And option D, Cumulative Index to Nursing and Allied Health Literature. So that is the correct answer. CINAHL means Cumulative Index to Nursing and Allied Health Literature. Option D is the correct answer. The next question. The primary purpose of administering corticosteroids to a child with nephrotic syndrome is? Options. Option A to reduce inflammation. Option B to reduce proteinuria. Option C to increase blood pressure. Option D to prevent infection. Our question. What is the primary purpose of administering corticosteroid to a child with nephrotic syndrome? The main classical manifestation of nephrotic syndrome are massive proteinuria, hypoalbuminemia and edema. Okay, so here administering corticosteroid is mainly to reduce or to decrease the proteinuria. Option B is the correct answer. And the next question, the innermost layer of the heart is called? Options. Option A pericardium, option B myocardium, option C endocardium, option D visceral pericardium. Question, which is the innermost layer? Epicardium, myocardium and endocardium. That is the order, pericardium or myocardium or endocardium. Endocardium is the innermost layer. So option C is the correct answer. Next question, a pattern of adjustment followed by an individual to relieve anxiety is known as? Question, a pattern of adjustment, an adjustment mechanism followed by an individual to relieve anxiety is called? Options. Option A compensation, option B acceptance, option C denial, option D defense mechanism. It is correct answer is defense mechanism. Defense mechanism is a pattern of adjustment followed by any anxiety or stressful situation. Option D is the correct answer. On to the next question, which is a perception disorder? Options. Option A hallucination, option B apathy, option C delusion, option D obsession. Perceptual disorders are illusion and hallucination are perceptual disorder. Here option A is the correct answer. Options. Option B apathy. Apathy is a type of affect disorder, and delusion and obsession are disorder of thought. Here hallucination is disorder of perception. Which of the following is transmitted by rodents? Options. Option A Ebola virus, option B polio virus, option C Norwalk virus, option D hepatitis A virus. And the correct answer is option A Ebola virus. question, who is popularly known as the Grand Old Man of India? Options. Option A, Sardar Vallabhbhai Patel. Option B, Subhash Chandra Bose. Option C, Dadabhai Nauroji. Option D, Jawaharlal Nehru. And the correct answer is option C, Dadabhai Nauroji is known as Grand Old Man of India. Question. The period between exposure to infection and appearance of its first symptom is called. Options. Option A, incubation period. Option B, exposure period. Option C, latent period. Option D, window period. The period between exposure to particular infectious agent and appearance of first symptom is called the incubation period. Option A is the correct answer. Next question. Intravenous drug administration is typically used for children. Options. Option A, critically ill under age 6. Option B, over age 6. Option C, under age 6. Option D, critically ill and over age 6. So, intravenous drug administration is typically used for a children with critically ill under age 6. Under age 6 and it is critically ill. Intravenous administration of drug means medications or injections usually giving into the bone marrow, that is known as intravenous drug administration. And the next question, a river drains the water collected from a specific area which is called its options. Option A, catchment area. Option B, water current. Option C, watershed. Option D, water divide. A river drains the water collected from a specific area and which is called it catchment area. Option A is the correct answer. The next question, the natural aging of a lack by nutrient enrichment of its water is known as. Options. Option A, precipitator. Option B, planktonic. Option C, eutrophication. Option D, biomagnification. And the correct answer is it is eutrophication. Option C is the correct answer. And the next question, the most common cause of embolism is. Options. Option A, bone fragments. Option B, erythematous debris. Option C, air bubbles. Option D, thrombus. The main cause of embolism is the formation of thrombus. Option D is the correct answer. Move on to the next question. The role of a nurse in protecting the patient human and legal rights is that of a. Options. Option A, patient advocate. Option B, communicator. Option C, educator. Option D, patient caregiver. She is he is as a nurse, she is protecting the patient human and legal rights, is act as a patient advocate. Option A is the correct answer. A plan prepared by a teacher to teach a lesson is called. Options. Option A, lesson plan. Option B, course plan. Option C, master plan. Option D, unit plan. A plan prepared by a teacher to teach a particular lesson is known as lesson plan. The drug used for induction of labor is. Options. Option A, ergometrin. Option B, progesterone. Option C, oxytocin. Option D, methergin. The drug which is used for the induction of labor is oxytocin. Option C is the correct answer. Move on to the next question. What is the full form of KCC scheme in agriculture sector? Full form of KCC. KCC means Kisan Credit Card. Option B is the correct answer. Kisan Credit Card. Next question. Sterilization of glass wires is done through. Options. Option A, disinfection. Option B, moist heat. Option C, fumigation. Option D, dry heat. Which method is used for the sterilization of glass wires? Glass wires are sterilized by using dry heat. Option D is the correct answer. The term aerobics is associated with which of the following games or sports? Aerobics is associated with which among the following games? Options: golf, gymnastics. Option C, chess. Option D, cricket. And the correct answer is option B, gymnastics. The next question, the storage form of carbohydrate in animals is options. Option A glucose, option B starch, option C heparin, option D glycogen. Storage form of carbohydrate is glycogen. Option D is the correct answer. Till 40 questions we discussed today, and the remaining questions we can see in the next videos. If it is useful for your studies, please share my videos to your friend circle.